Okay, good morning, everybody. If certainly more than dynamics, the complexity of that, I'm glad I'm not running the study. I'd like to talk about our program in Papua New Guinea, and this sort of puts a different line on partnership, moving from research to project implementation and grant implementation as well. So Oil Search is PNG's largest oil and gas producer, and mainly operating out of Papua New Guinea, but also has operations out in the Middle East. And Oil Search has been in Papua New Guinea for about 85 years. It's grown significantly over the last 10 years and has a market value of about $15 billion. So with that amount of income coming in comes a certain level of responsibility. And what we've done with the company is create the Oil Search Health Foundation. So I'm just going to give you a bit of a history of that. I'm a nurse by trade. I'm a health practitioner, public health specialist, but I certainly don't know much about oil and gas. And so I can really talk about our programs. So what happened about sort of nearly 20 years ago now, the company has always had its doors open. I think this is something quite unique about Oil Search. All companies have a different way of operating, and one thing that we've done is being part of the community, and that's a strong emphasis that has been there for a long time. So we've got a medical and occupational health service within the Oil Search company, so within our sites that are dotted around the highlands and in the Gulf Province. And there for our workforce, but also the community who are living in those areas have been able to access those clinics for some time. So if a woman turns up with a sick child and the government facility or another facility down the road is unable to cope with that, they'll come into our service and we'll look after that child and the mother. So sort of in the mid-2000s, that moved on to malaria. And of course, malaria doesn't have fences. And a lot of work that happens in companies is often within a fence line. But of course, malaria crosses over those fence lines, and if you can't look at the community, look at where the reservoirs of malaria is, you're not going to be able to protect your workforce. So this grew from doing interventions like community fogging, indoor residual spraying, and that moved on to doing malaria treatment as well. Further down the track, we started to engage in HIV. In the first instance, we were looking at HIV in the workforce, and that was there was a HIV in the workforce policy that was instituted, and HIV testing was taking part in the workforce, but also community patients that were coming into the clinic also started to get tested for HIV. So we took it to that next level, really, and we engaged with the Asian Development Bank, the ADB, in what was called the Rural Enclaves Project. And this was a project that ran mainly in the highlands, but it engaged a number of different companies, some in the agriculture business, and some from the extractive industry, and Oil Search was one of the key partners in that. So we had some funds from ADB, which was also matched with funds from Oil Search. And that went out into the community and looked at scaling up HIV testing, treatment and support. There was some capacity money in there to reopen some clinics, provide support for the healthcare staff in terms of training, getting better security for the healthcare clinics. It might have been refixing water supplies that had running water again, electricity, etc., solar panels and things like that. So that was quite a springboard for us, particularly in terms of HIV. Further down the track, and one of the key things, this was about partnership with the provincial government as well. And everything that we've done over the time with HIV and our malaria and maternal child health programs has been in partnership with the government, both nationally and locally. And everything we do is in accordance with national policy in terms of our strategy, our treatment guidelines, etc. So back in 2011, there was a number of Global Fund grants in the country, a TB grant, a malaria grant, and a HIV grant, and we're invited to be a sub-recipient of the Global Fund grant. And that changed. At the time, the Department of Health was the principal recipient. And if anyone's ever worked with Global Fund, it's certainly no mean feat. It's quite a challenge. And the principal recipient role changed at that point in time, and we're invited to be the principal recipient. This was something quite new for us. We were a corporate organisation who hadn't managed such a grant, so there was lots of challenges ahead. But with the blessing of the country coordinating mechanism, the Department of Health and a number of stakeholders, including our colleagues of the Australian Government from AusAid at the time, now the Department for DFAT, for Foreign Aid and Trade, we took on the role as the principal recipient. So that was managing two grants, the malaria grant and the HIV grant, combined worth about $46 million. Although the HIV grant was $46 million over 5 years, and we went into phase 2 for the malaria grant, which is about $22 million. Further to that, in 2012, we developed the Reproductive Health Training Unit, and this was another public-private partnership with the Australian Government, the Department of Health, and the University of Technology in Sydney. And this is a unit that has predominantly midwives who are going out across the country and basically skilling up midwives who many of them hadn't had any contemporary emergency obstetric training for some years. In 2013, we passed our 40,000th HIV test. Not that we're delivering those tests, we're supporting community clinics out there who are delivering those services, but our capacity support, capability support has gone a long way. And then our latest initiative is something called the PNG Industry Malaria Initiative, called PIMI. And this is looking at that public partnership model, public-private partnership model, drawing in other industry. In Papua New Guinea, the work that we've done has attracted some attention from other corporate citizens, and we've all got to sort of respond to this sort of social corporate responsibility. And PIMI's emerged as something that allows us to take our experience, work with other companies in the country, those from the agribusiness, those from, again, oil and gas. So we've got palm oil, we've got sugar, etc. industries who are looking at malaria, and some of them have been doing malaria for some time but not really engaged with local and national government, not aligning to national strategy. So the role that this will take will be helping people harness and create those dynamic partnerships. So how we work. Really, as I've talked about this public-private partnership, and this is about drawing together, and there's a risk that if you do it alone, that you can get very heavily criticised for taking on the role of the state, and it's not a place that we really want to be. We're working with the communities in Papua New Guinea, and for us it is totally essential that we have that unique linkage both at the national level, also at the provincial level. But also not just with government clinics, we also work with our colleagues in the faith-based sector, which is quite a significant part of health services in Papua New Guinea. And as I've already talked about, for example, with PME, we're working with other corporate partners there. So we've got our 3 programs. I won't run through all of these. But again, this is where we're aligning to the national strategy. So you'll see our 3 key objectives for our HIV program come out of the national HIV strategy. The same for malaria and maternal child health. So what do we do? So we've got an oil company who's working in several provinces in Papua New Guinea, but we're actually working beyond that. So, for instance, we've got a team of us in Port Moresby. We're very engaged with the Department of Health, sitting on national technical working groups. At the moment, we're going through the reprogramming grant for the Global Fund, so a number of us are very engaged in the concept note for that. Principal recipient role, as I've already talked, this is quite a significant role, but it's something that we work with our partners. There's 5 sub-recipients and also implementing partners, so the Department of Health is a key implementing partner for that grant, but also working with WHO, Burnet Institute, the Catholic HIV/AIDS Service, Anglicare, and another of partners. At local level, how we work, we generally have a team who are out there and some of them are in the audience, who are out there providing training in terms of HIV testing, again working to the national standards, using the national treatment guidelines, using the national curriculum for HIV testing, treatment and care. But one of the key successes we have is our ongoing mentorship. It's all very well sort of running a HIV testing course, but unless you sort of follow people through in that community clinic through and hold their hand through for a period of time, there is that risk that people go back to the clinic and sort of do what they've always done and the HIV testing doesn't take place. Our logistics support, of course, as an oil and gas company up in the Highlands there, we've got phenomenal resources in terms of logistics. And the Highlands in Papua New Guinea is very remote, it's very difficult to access. You can't drive in, there's a lot of places you can't drive to. So there's, our ability to, use our own sort of airline, our charter flights that we use, etc. We generally support the M&E for the country. So again, it's working with the clinics and helping support that. And that's about bringing data back from the community health services, linking that in with the provincial disease control surveillance teams and at the national level. And general community mobilisation, going out and doing HIV awareness. We've been engaged in a gender-based violence program, and also we did some work in secondary schools, which was not about going and teaching teachers all about HIV. They know about HIV, but they sort of couldn't cross that bridge in terms of what their confidence in talking about sex, relationships, negotiating safer sex, etc. So building that competence and confidence in teaching personal development, as it's called in PNG. So we've got programs. We're not necessarily working just in our oil asset areas. We've extended it beyond that. And I think this just shows the true commitment for the company. So Morro Bay is an area that through the Global Fund grant, Hela in the up at the top of the Southern Highlands there, again through the Global Fund, we've been able to scale up services there. And we've just started a program down in Milne Bay. I'm not going to show you too much data, but this is just one example of where we got involved in Morro Bay. And as you can see, there'd been a slow scale, or a rapid scale up for a number of years, then it sort of plateaued for a few years through the Global Fund grant in partnership with the Morro Bay Provincial Government, the Department of Education in Morro Bay as well. You can see we've gone from 26 clinics up to 57 clinics in a 2-year period. Looking at HIV testing, this moves over to one of the other provinces we support in Hela. We've had a phenomenal uptake in HIV testing. So all in all, between the two provinces, we've scaled up an extra 40 clinics in the last 2 years and in Hela alone, added another 25,000 tests onto the national data. Certainly this doesn't come without its challenges. And one of the key things is about those expectations, both from our side, also from the national provincial government, local health services, and our community recipients, so those living with HIV, the patients in the community clinics. And we're always sort of brokering and managing that relationship. And as Helen was saying about those partnerships, it's crucial to get those right, and it's constant work around that. There is that sort of maintaining that balance between the state function and what is the role of a corporate company. And there's that fine line. You've got to be careful about that and not sort of taking over, and that's something that we're very keen that we maintain that line, that we're working in partnership with the government, and that it's not about us going out there on our own and doing what we want to do. Also, the thing that is quite different, when you're working within a corporate organisation, for most of my life I've worked in the public sector. It was my first experience working for someone like Oil Search. And certainly we do have a different standard in terms of, particularly around risk management. And it's about being able to broker that. You're stepping outside the fence, you're working in the communities, particularly in Hela. It's an area that there's still a lot of clan clash violence on a daily basis, and every now and again you get these outbreaks and we have to evacuate teams. And it's very important that our most important asset is our people, our staff, and we've got certain standards that we need to meet to be able to protect them. And it's being able to broker that and meet at the right level, not expose our team at all. In terms of what makes a success of our program, for me, I think it's about our executive leaders. For instance, at the conference here, we've had a managing director, we've had our chairman of the board, and some of our executive managers here, and these are guys that run this massive company, and I think for them to take out a few days is incredibly important for us as a team and shows the level of commitment that we have to doing this. So, as always, with any success, leadership from the top that filters right down to ground level is incredibly important. And as you've heard me talking about, coming back to those, fostering those strong and meaningful partnerships that actually work, they're not sort of just on paper. And managing risk, physical, financial, and reputational is very key for us. So just in conclusion, PPPs, public-private partnerships in global health, they're changing the landscape. If we looked at where funding streams were coming from 15, 20 years ago, and how they've emerged, we've got a whole change in the global financing environment, and it continues to change and evolve. And there is a role for companies like ourselves to be engaged with a range of partners to actually affect interventions on the ground. And so leveraging our expertise, our logistics, and also the company's finances, and combining that with others is a way forward in the direction that we've been heading. Thank you very much.